Well, breast cancer accounts for nearly 1 in 4 of all cancers among women globally, with the World Health Organization estimating over 600,000 deaths every year. In Nigeria, the situation remains worrying, as health experts revealed that more than 70% of breast cancer cases are diagnosed at advanced stage, nearly and largely due to poor awareness, late presentation, and limited access to screening facilities. As the world marks breast cancer awareness, the call is for stronger health system, affordable treatment, and community-driven awareness. To discuss the gap and progress made in Nigeria's fight against breast cancer, we have in the studio the Chief Operating Officer, the Decas Foundation, that is Korede Akindele. Good morning. Thanks so much for joining us on the program. And also joining us via Zoom is oncologist, Chief Clinical Coordinator, Luth Cancer Center, Dr. Mohammed Habeebu. Good morning. Thanks so much for joining us on the program, gentlemen.
Thank you. Good morning. Thank you for welcoming me.
Let me start with you, Dr. Mohammed. The figures are alarming. Statistics are coming out daily about the recurring decima of cancer. What exactly is cancer, and how does this help to develop the body and also bringing down the body that make a lot of people to die? The statistics here from this particular organization is saying in 2025 about 32,000 die of cancer yearly. These figures are worrisome. What's your take on this development? Hello, Dr. Mohammed, are you there?
It's avoidable to have. I'm there. I can hear you. Can you hear me?
Yes, we can hear you loud and clear.
Hello? Am I audible?
Yes. You are audible. We can hear you loud and clear.
Okay, thank you. Okay, good morning.
Good morning.
The figures are quite worrying. They are quite worrying, and this is because it's avoidable. This is avoidable. Cancer itself is are cells. They are abnormal cells in the body that refuse to, respond to the normal body control, and they have the ability to invade the surrounding normal cells, and they also have the ability to spread. Yes, the mortality rate is so high, especially in developing countries like Nigeria, because patients present late after diagnosis. They present late, they are diagnosed late, so the treatment becomes very difficult. And the late presentation ultimately is incurable. It's only those who present early that that can be cured. Like you said earlier, there is a lack of screening facilities, not enough, lack of personnel, and also lack of awareness. And then there are other myths that surround cancer that makes patients not to present early, even when they are diagnosed early. And the treatment is also very expensive, and the patient pay out of pocket. This is what I would say is the most major barrier. As soon as we can have robust insurance that can take care of screening, take care of treatment, I believe many more patients will present early and will have better prognosis or better treatment outcome.
All right, Korede, let me come to you. He mentioned that the mortality rate in Nigeria is a bit high because patients present late. But what are the early warning signs? Because you can't just wake up one morning and say, I want to go and do a cancer screening. So what are the early warning signs that patients can look out for in their bodies?
All right, thank you very much, and thank you for having me. So, I mean, early detection, like you said, it's so important. And when we talk about breast cancer, in women and even men, this is Breast Cancer Awareness Month. So, like you said, it is important for every woman to check themselves this is October. This is an opportunity to be able to, there are free tests, free mammogram going on across different parts of the country that you can check yourself. And so, like you said, that, okay, you cannot just wake up one morning and say you want to, but every woman as and owns of themselves. For example, there's self-check that you do as a woman that you can do every morning, and so you don't need to wait and say, okay.
I'm about getting to that point.
So you don't need to wait and say, okay, because I'm not feeling like this, I'm not feeling like this. No, especially when it comes to breast cancer, you can press your breast, you can press your lumps and see if there is anything growing, lumps or anything hard there. So it shows you as a woman. You understand? Because, and also there are tests that you can run even as men. Prostate cancers, colon cancers, all these things. So for adults, I mean, there are warning signs that shows that, okay, something is going wrong, something is not going well in your body.
What are the signs?
I would like to ask a question. Sorry, as the only woman on the table. I would like to ask a question because sometimes when, for example, you are, let's say, almost on your period and you happen to do a check at that time, you feel some things, but when the period is over, it's gone. How would you explain that?
So, I mean, you are going through a cycle of something.
Yes.
And then you feel some things. And when it's over, it's over.
Yes.
It's not that it stays there. But when it stays there and then you start seeing something dysfunctioning, you know, when an orange, I mean, is getting bad on the, you start seeing those signs, that means something is wrong. You need to quickly take a steps to you.
What are those early signs? Because that is crucial that we need to know. Because a lot of people do all this self-care, self-medication, and they don't check those signs. So tell us those signs that men and women also need to know.
Okay, for example, I mean, this is Breast Cancer Awareness Month, and one of the signs is the way your breasts grow. I mean, if you see some discoloring on your breast, then something is wrong. If your breast seems, I mean, a bad orange, you know, this peeling around it, or it's dropping some kind of stuffs, some mucus or something, that means something is wrong. And then for prostate cancer, I mean, maybe your urination is not coming as it should be, or you're feeling pain unnecessary in some part of your body. So it's self-medication does not help. And when it comes to cancer treatment, it's not something you treat at home, or it's not something you treat in nearby hospital. That's why it's always good to pay attention to your body. So cancer is in different stages. You have the adult cancer, we have the children cancers, and so everybody, what is so important is you know the aspect of your body. I know as an adult, I mean, I can come here this morning, maybe even tired, and not pay attention to my body system. You know, I can feeling headache here, but because I've been invited here and I need to be here, I will just
ignore those signs.
I will not ignore those signs, and that is one of the things, because of responsibilities around our lives, we try to ignore those signs and don't focus on it until it becomes a serious issue.
Let me come to Dr. Habeebu. Can a man be down with breast cancer?
Men can be down with breast cancer. Actually, according to statistics, 1 out of every 100 patients that have breast cancer is a man, while 99 are women. So men are down with breast cancer.
So what are those signs such men should also look out for?
Well, the similar sign, breast cancer in men and women are the same. Only that for men, the breasts are rudimentary, so it's easy to see. So what we look for is lump in the breast, abnormal discharge from the nipple, usually bloody discharge, the abnormal, you know, what looks like a scar or what looks like eczema on the skin of the breast. That's erythema, eczema on the skin of the breast, and chronic ulcer. That is a wound that refuses to heal around the breast. Usually, if there's a breast cancer, after a while, you also see a lump at the armpit, at the axilla. That's what we call lymphadenoma, lymph nodes, you know, at the axilla. And usually, if still you do not attend to this, it starts to spread, because cancer can spread. So it can spread to the lungs, and you can see the patient presenting with cough. It can spread to the bones and cause what we call pathological fracture. And the patient may start losing weight, you know, because the cancer cells, they can feed on the, interfere with metabolism and cause loss of weight. And this is almost similar with female, only that for female, the breasts usually are well developed, so they can hide the lump. So you need to be concerted. You need to pay concerted effort to do self-breast examination. That's the female examining her breast regularly, maybe in 6 months or a year, if there's nothing, after the first few examinations. Then what we also call clinical breast examination. The patient goes to see either a doctor or a nurse who is well trained to examine the breast. Then also a woman, apart from self-breast examination and clinical breast examination, you're also required to do breast ultrasound scan regularly. That is using a scan to check the breast, because what your hand cannot pick, a scan may be able to pick. And for women that are more than 45 years old, they also need to do mammogram, because the breast of women that are much advanced in age is usually less dense than those that are younger. So mammogram will pick what ultrasound scan does not pick at that age. Doctor. And at times you may need to do the two. And screening is very important because it picks the early signs of breast cancer. And by the time a patient is having symptoms, that's having pain or having obvious swelling that is marked, it might already be a higher stage. It might be becoming late. It might be advanced. So it's very important to have screening even before you start having signs and symptoms of breast cancer.
Okay, Dr. Habib, we've seen my colleague read out some statistics about the high number of cancer incidences in the previous years. But what is the cause of cancer? What are the causes of breast cancer and different kinds of cancers? And if maybe you are diagnosed with breast cancer, what are the next steps that you can take?
The cause of breast cancer is multifactorial. There are many factors that can result to breast cancer, but largely they can be divided into inherent factors or genetic factors and acquired factors. It's the acquired factors that you can work on more, but the inherent factor with the genetic factor, you can do gene typing. You can check your gene to see if you have the familiar traits, which usually is BRCA1, BRCA2. This usually will account for about 20% or less of breast cancer. And those who have this gene, the breast cancer will run in their family. You see many of their females having breast cancer, like the mother, like the grandmother, aunties, cousins, and so on, sisters, However, the acquired factors, one important factor is also sedentary lifestyle. Then how early the person starts menstruating. Those who start menstruating, what we call menarche, at very early age. And then they also have delay menopause. They start menstruating very late age, and also probably do not have children. We say they are nulliparous, or they give birth, they do not breastfeed. All this will increase the chance of having breast cancer. Then exposure to ionizing radiation may also increase it. Those who have breast lump, who are hitherto not malignant, are also predisposed to having breast cancer. So if you have breast lump, but it's not cancer, it may predispose you to.
It's a fine place. It's a fine place to live it. Oncologist and Chief Clinical Coordinator, Luth Cancer Center, Dr. Mohammed Habib. Many thanks for joining us on the program this morning.
Thank you for having me.
Thank you.
Thank you. Back to you heard what he said about lifestyle, and that is very crucial.
Yeah.
A lot of people do not control what they eat. So how do we ensure that what we eat makes us healthy and have long life, devoid of any form of cancer?
And also, while you're answering that, I noticed that you nodded your head when you mentioned women that start menstruating early. What age would you put that early bracket in?
Early. I mean, people now, things are changing in the body rapidly.
Because from when I was in secondary school, we were starting menstruation from as early as 12, 13.
12, yes, 13.
So is 12, 13 early, or is that the normal
No, 12,
age?
13 is fine. I mean, you can start menstruating from 12, 13.
So I'm assuming he said 9, it was meant 9, 8.
No, 12, 13. I mean, people menstruate from 12, 13, and then, so it shows that your body is responding, your body is growing, and your body needs better attention than what it used to be. Yeah, so it's so, I mean, you talk about lifestyle, you talk about
Absolutely.
What we eat. But the truth is, I mean, every food that we eat must be healthy. I mean, you can say, okay, we were having a conversation, I mean, about last week, and a child came into the hospital, and I was like, oh, they said I should not eat these, I should not eat, and the coach was like, why? Why are you not eating this? So what you eat or what you not eat does not have a cause for cancer.
Is cancer hereditary?
Cancer, yes, there's genetics, yes. They trace if there is something like that has occurred in your family line when you're doing that. Okay, so it's just to trace and to say, okay, let's know, okay, has anybody in your family line has cancer before? It's just to trace the line and say, okay, fine, okay, maybe this can be the cause why it comes in your body. Do you get?
So if you have a trace in the family line, so what do you need to do?
So if you have a trace in the family line, it's just that every one of them should just try and make some tests. Yes, just try and take some tests, especially women. Yeah, to take some tests. And then cervical cancer, I mean, ensure that you have the HPV vaccine for children under the 13, 12 years, so to save them, protect them, and to also watch multiple sex and all those things could cause it. And also to watch your lifestyle. For example, lung cancer, you're prone to, I mean, we can say risk factors can be, this person is a smoker, he does smokes, and then is prone to this. But we have seen people that has lung cancer not as a result of smoking, and because that is just once in 10 things. But those things, those biological effort that is around our life, it's something we have to pay attention to. What you eat well. Okay. There's nothing you eat or you do not eat that could spark cancer in your body. But the most important thing for you, it's like you controlling your diet. I mean, absolutely. You controlling your diet, and don't say, okay, everything I see must just go into my mouth. Everything I see is what I must consume. No.
So let's quickly speak to the HPV vaccine.
Yes.
You made mention of that for 12, 13-year-old girls.
Yes.
So at what point can they take it? Because there's this perception out there now that even when the state governments are moving around to give these vaccines to young women, a lot of parents are saying, no, my daughter will not take it. I have an experience on that. Yeah. That's what I'm saying.
Yeah, I mean, that's why awareness is important. That's why education is important. And that's why we keep talking about it. We keep advocating for it, that look, it's protecting your child. Imagine, I mean, all these vaccines that people, I mean, that when you have a child now, you take those child to the hospital, they give you tuberculosis vaccines, they give you measles vaccine, all those vaccines. So imagine years ago when those vaccines were introduced, I'm sure there'll be kickback also. They're like, no, you don't want to turn my child. I mean, for example, I mean, when COVID struck, I was not in the country, and I tell you, I think I have 6 shots of COVID vaccine. Yeah. And
there are some people that do not take it. There are people that do not take it.
I have like 6 because I was not around. I take 2 and I was like, I want to travel, come into Nigeria. I said, no, if you're going to travel, then you need to take another one. Then I went for Pfizer like 2 times. And someone said, oh, you turned into a robot. Am I a robot today? So you saw those kickbacks. Do you get? So there will always be kickbacks, but when awareness, when education comes in that, look, this is the benefit, yes, there will be kickbacks. That's why government is trying, and every advocate, every medical person is trying to, even we've gone to religious center to advocate and say, see, we are protecting this child from, because cervical, it's a disease that nobody, it's a type of cancer that no one should die for. Okay. Anymore.
It's a fun place to leave it. The Chief Operating Officer at Doctors Foundation. Thanks for joining us, Dr. Korede Akindele.
Thank you so much.
Thank you so much for joining us on the program this morning. Now, away from health, still ahead on TVC Breakfast Saturday, with alliances shifting and loyalties tested, how will the gale of defections shape the 2027 election? We'll be discussing these and many more after the break. Join us again.